Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights. Delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Hi, everyone. Welcome back to the TechLink Health Podcast. I'm Govind Chandram, and I'll be co-hosting this episode with Dr. Rodney Saman. Today's episode focuses on the future of health plans and alternative funding strategies for health and wellness services. This episode's guest is Zach Redman, a health benefits strategist and currently Vice President of Business Development for Evolution Healthcare, an alternatively funded healthcare plan. He is focused on changing how employers buy and interact with health plans by helping groups transition from fully insured to a self-funded model. It goes without saying that Zach has value-added expertise in health-funded strategies, and we're very excited to get his perspectives on the future of healthcare. So without further delay, please welcome Zach Redman to the podcast. Thanks for joining us today, Zach.
Hey, Govind. Thanks. Happy to be on here.
This is such an interesting time in healthcare, particularly in the last year, that we're seeing rapid changes and transformation, not just at the clinical level as far as COVID and virology, but also at the healthcare delivery level. One thing that is important for folks to understand is some of the nuances in how health plans are administered, how they're delivered, and how ultimately they interact with the patients. But before we get into some of those details, can you give our listeners some background and maybe take a second to tell us about your journey with digital health?
Yeah, absolutely. I've been in the healthcare industry for over 10 years now, and all on the health insurance side, and more specifically in the commercial space. I started fresh out of college working for a large national carrier in a couple different capacities, but primarily selling the major medical commercial health insurance plans to small and mid-sized type employers. And when I did that, I primarily sold a variation of a fully insured health insurance product. And basically that is a prepackaged plan that employer would buy or pay a fixed amount of premium on an annual basis in exchange for the insurance company to pay claims for them for covered individuals on the plan based on what those preset benefits may be. These products are good in the fact that they're pretty straightforward. They're easy to administer. If you're an owner or a CFO, they're very easy to budget for because that cost is fixed. However, there are some downsides to it as well. In a fully insured type of product, there is some rigidness or inflexibility as far as what is and is not covered and things that maybe you can add in there or carve out as far as plan coverage is concerned. It's very difficult sometimes to really understand and identify what is going on health-wise within the employee population. And if you're an employer, and let's just say, for example, you have a positive claims year in a fully insured environment, you do not get to participate in any type of premium surplus where the health insurance carrier would say, hey, you actually ran or paid too much premium this year. You didn't have as many claims. We're going to give you this money back. That doesn't happen in a fully insured environment. The health insurance carrier would retain all that. Whereas in a self-funded type of arrangement, if you don't have a claim, you get to retain all of that. So as I worked at this large national carrier, I started to kind of become more cognizant of other options and funding solutions that were out there. And I really started to peel back the layers and identify that over the last 20 years or so, there's been a mass consolidation of health insurance carriers in the marketplace where you could practically walk down the street corner 20 years ago and be a different carrier to today. We, for all intents and purposes, buy our health insurance on a national scale in an acronym, which is BUCA, which you may have not heard that phrase before, but it stands for Blue Cross, United, Cigna, Aetna, and then Humana. So 4 or 5 players, depending on where you live. But those are really all the major carriers at Evolution Healthcare, and we work with fully insured clients that are in that fully insured environment today and help educate them on moving to a self-funded arrangement. And so we offer a partially self-funded health plan through what we call a just add water approach to self-funding. And our philosophy is we don't believe that healthcare should be prepackaged or a one-size-fits-all approach. And so we're composed of different plan design, and cost containment experts, risk management, reporting analysts, wellness innovators. We bring together a specifically customized health plan for certain employer groups that allows them to offer a more affordable, sustainable, and comprehensive health package without having to sacrifice the benefits to their employees, all by funding it just in a slightly different way. And by doing that, it really opens up a whole new world to truly understand where your healthcare dollar, if you're a CFO or you're an owner of a company, where that healthcare dollar is going. And then once you understand that, building a comprehensive strategy around, okay, now that we have the information, where do we want to take this health plan? What do we want to do with it? So it's been a lot of fun and still a lot to accomplish, but it certainly has opened up a whole new world for me.
Just to clarify, are your clients fully insured and you add on a layer of self-funded health plans, or are you transitioning them all together into a partially self-funded model?
Yeah, so we are transitioning them completely into a partially self-funded model, and they are currently fully insured clients, and we are helping them to understand the partially self-funded solutions. We have built a health plan that looks and feels like it is fully insured, but comes with all the luxuries of being self-funded, which gives you more access to data and more transparency to make educated, healthcare decisions. And knowledge is power. And so what we're doing that you're not really seeing in a fully insured environment is we're able to really integrate the data of a health group or of a population down to the member level and provide a 360-degree view of each individual member and look at things like there is an avoidable ER admission here, and there was a no-fill prescription over here that triggered a gap in care, and then work with those members at the appropriate level to get those type of things resolved. So by being able to drill down to that member and claim line level, we're able to turn that data into an actionable strategy to improve the overall health plan performance. Whereas in a fully insured environment, you're not really getting any of that. The data or the information that you do have access to is very, very limited. And a lot of times that data has a lag on it of up to 6 months. Whereas in that self-funded environment, you just have so much more access to information and data to make better educated decisions.
Hey, Zach, this is Dr. Saman. What you're doing is awesome. I'm curious, in terms of the savings data, how much savings have you been able to show? And how do you deal with drug formularies? And then also, how engaged do you get with the employees?
A lot to dive into there. Or as far as how much savings are we able to show? It might be good to take a step back and explain what components go into that premium and how it's comprised. The really big misconception is that there is additional risk in that self-funded environment, and it's really not the case. When you really start to pull back the layers and look at what components make up a fully insured plan, we at Evolution really like to break this down as an example of a pie chart. And we show that your healthcare dollars are allocated in the frame of only 30% of your total spend are for fixed type of costs. So that gives you an additional 70% of the overall healthcare spend to really manage and control those costs in a different way. And what you find in the fully insured world is that universally they'll tack on anywhere between a 15 to 25% margin for error. And what will happen is year after year, as it becomes renewal time, a employer group will receive their renewal letter in the mail, and it could be 10, 20, 30, 40. I've seen them as high as 60%. And what happens is that 70% of those claims aren't being managed at an appropriate level, and they've gone too close to that margin for error. So in the fully insured environment, what they do is they just make your entire pie bigger. But you're not getting a premium increase because the billing or claims representative needs a pay raise, or you're not getting that premium increase because of network access. It's because of how those claims are being managed. And so when you look at peeling back that layer, the claims piece is the biggest piece.
I realize this gets really convoluted. I also want to talk about the medical loss ratio and how that applies.
Yeah. So when you're talking about the medical loss ratio and how much a health insurance company can profit, for example, which 80% of it needs to go to healthcare related expenses, right? In the very large group, it can be 85%, but that really gives the health insurance companies 15 to 20% as far as profit. You can make a very good argument or case that the health insurance carriers and some of these major players are de-incentivized to slow down the cost of healthcare. Because if you're doing some simple math, and if you're saying, you have $1.2 million in annual health insurance premium, and you multiply, I say, what is 20% as far as profit margin is concerned? I believe that's $240,000 in profit margin. Well, if you make that premium go up, then your profit margin also goes up. So it's a de-incentivization almost to really control or manage those costs.
In terms of the formulary and also how involved you become with the employees.
Yeah, so I think this is one of the things that with Evolution Healthcare is a great thing that we personally hang our hat on and do a really, really good job with. The prescription drug game is out of control. Specialty medications, for example, are a huge driver of costs. In the next 5 years, specialty meds will make up over 35% of all pharmacy spend. And when you start to look at what's wrong, it starts with really peeling back the layers and continuing to expose some of these bad practices, like these PBMs that are doing things like spread pricing, for example, and looking maybe even at how other countries are handling the prescription drug game, where their citizens are oftentimes paying a fraction of the cost that we're paying here in the United States, literally for the exact same drug. So circling back to how we get involved with the formulary, we have a couple different layers. When you're talking about providing and managing claims in a different way, it's about bringing different solutions to your client, allowing members to pull different levers or have multiple resources. We have an option through manufacturing assistance, for example. We have internal resources where we can help a member apply and get approved for manufacturing assistance programs. So that's something above and beyond a strong and transparent PBM contract. The other thing you're going to continue to see evolve, and I kind of mentioned it, was tapping in and utilizing other countries and acquiring medications internationally, which is another resource that we have within our health plans for members on a voluntary basis. We have access to over 300 different brand name medications through our exclusive government licensed physicians and pharmacies in tier 1 countries, such as United Kingdom, Australia, Canada, New Zealand, where we are literally getting that exact same medication that shows up at the member's doorstep in that original manufacturer seal label. And because we're acquiring these through these tier 1 countries, we're able to get savings anywhere between 30 and 85% less of what we're paying here in the United States. And we're talking about brand name drugs that you're seeing commercials on TV today here in the US. So like Januvia, Xarelto, Jardiance, literally thousands of dollars in savings available just for acquiring that same drug through a different channel. So when you start to talk about how you're acquiring drugs on a formulary, what type of drugs go on a formulary, is there a rebate tied to that formulary? For us, it's all about net less cost. And rebate is a big piece. Everyone wants to get a rebate. But for groups that we're working with that are in that fully insured environment, they're not seeing any piece of that rebate today. And so in a lot of instances, it makes sense to provide solutions that are net less cost, like going internationally to acquire that medication for $10,000 less, as opposed to running and chasing down a rebate that we don't even know necessarily what it is.
Well, that's very exciting. Are your products only available through the employers, or can somebody go online and purchase insurance, kind of like Oscar or something along those lines? Is this a consumer product as well, or just a business product?
As it stands today, Evolution Healthcare specifically is for mid-market employer groups between 51 or so employees all the way up to 1,500 or so. And really, that's a lot of the American population and how they acquire their health insurance. 156 million Americans acquire their insurance through commercial health plans. Right now, we work primarily through the broker community, where an employer has a broker health consultant that advises them on the choices and options that are available out there to them, works with folks like us at Evolution Healthcare to create a proposal, deliver that proposal, and educate them. And then we work with them on that transition to ensure that it is a smooth one. As it stands today, it is for those mid-market clients only. But you are starting to see some new emerging health plans that are starting to go down to those smaller employer groups. And that's exciting to see, because a lot of those smaller employers feel like they don't have a lot of choices or options out there for them other than some type of fully insured arrangement. And if they can get some type of different funding mechanism where there is an opportunity to have some skin in the game, understand where the healthcare dollar is going, manage that in a different way, and then actually reap the benefits of seeing some of those savings as far as getting a surplus of claims dollars, then that is a direction that we should definitely move in. There are products out there like something called a level funded product. For example, that is a hybrid between a fully insured and a partially self-funded, available to some of those smaller market, smaller employer groups.
Wonderful. How do you deal with contracting and credentialing with providers?
Yes, a good way to explain that is to give you a general overview of our platform in Evolution Healthcare. And as I mentioned, to the end user, to the employee, for example, they're not really going to understand or know any difference of the funding mechanism. Is it fully assured or is it self-funded? To them, it is a healthcare product and they have access to the same network, the same providers that they always have. And so what we're able to do is we partner with several different networks. So we will access the Aetna network, for example, the Anthem network in certain states, the Cigna network. We will take that and identify where the location of the employer is, where their population resides, and what network makes most sense for them. And so we are tapping in and using those PPO type of networks, but then we're building around various other components from third parties to build our own specific health plan that is custom specifically to that employer group. And so with putting those layers in, you really start to see the protection and why it looks and feels a lot like a fully insured type of health plan. As far as the provider access goes, we have access to the exact same provider network that you would see on the fully insured side with Cigna, Aetna, Anthem, and so on.
So you're riding on the same rail lines as the other plans, and you're not creating a new rail line in that sense.
In that sense, we are, as far as the network. But one of the big differentiators as far as what we are doing and how we're utilizing the network is compared to how maybe one of the larger BUCA carriers is using their network. What you see right now is in a fully insured environment, certainly with a lot of these BUCA carriers, you're seeing an auto adjudication of between 85 and 90% of all claims, which in theory, it sounds good. Claim comes in, claim gets rubber stamped, claim gets paid. But in actuality, that means that upwards of 90% of the time, none of those claims are really getting looked at. And what that means, based on a lot of research and studies, upwards of 90% of the time as well, there's some type of error in those bills. So, CPT code is incorrect, or a duplication of a certain service or procedure wasn't even done and they were billed for it. So all kinds of different mistakes can happen in those claims, but when you have an auto adjudication of upwards of 90%, a lot of those are not getting caught. And so that is one way to a larger premium increase because you're paying for claims that were incorrect or never really happened. And what you'll find oftentimes is, you'll ask, well, that doesn't really make sense. Why would some of these carriers not do a better job of, maybe not auto adjudicating some of these? And what we have found is that when it comes to like PPO network discounts, for example, a lot of these providers will work with these different carriers and their networks to negotiate a certain network discount. In exchange for that discount, they will agree to auto adjudicate a certain level or a certain percentage of claims that come in. And so that is behind the scenes at how you can get to a 90% auto adjudication rate where there are a lot of mistakes that are not caught. And I think where we come in as a differentiator is we do not believe in a high auto adjudication rate. So while we're using that same network, while we're using those same providers, we are able to lower our auto adjudication rate to the tune of 60%, which gives us 40% of claims that come in to really identify and manage those in a different way. And a lot of times those are the claims for individuals who have higher health type of risks or higher health conditions. So we are then able to manage those claims in a different way. So for example, I'll give you one that we were able to identify where a person was getting Remicade, a specialty medication, done every 6 weeks at a hospital outpatient setting for $27,000 every single time they went to have that Remicade, drug administered. Our team was able to identify that and pull that claim, then reach out to the member and identify that they were eligible to have Remicade administered via home healthcare. By doing that, they were able to save over $21,000 every 6 weeks that Remicade was being administered. So that type of stuff is not necessarily getting caught in the large fully insured environment with that same provider network. So it's about pulling down that auto adjudication rate so that you can manage those claims in a different way, because just that Remicade example alone, those are real dollars and cents. From a CFO standpoint, that's saving a ton of money. But there's also an empathetic side to it as well. That member, and they no longer have to get in their car and drive across town 30, 45 minutes, pay $50 for parking and get that drug administered, and then drive 30, 45 minutes back. That member was ecstatic to know that they never had to leave, the comfort of their own home.
Excellent. And so let's talk about the savings for the companies. At the end of the day, they didn't spend that much on healthcare. You saved them money by doing home health or other visits. Did they get that percentage back at the end of the year?
Yeah, so that's the interesting thing about partially self-funded or self-funded insurance is they're not getting that back because it never left their bank account. They didn't spend it in the first place. And I think that's the big difference really between a fully insured environment and that self-funded one is, in that fully insured, the rate is fixed. This is what you're going to pay regardless how well you run. At the end of the day, if you're paying $100 and you only spent 50 of it, well, the insurance company is still going to retain that full $50 of surplus. Whereas in the self-funded environment, you're really only paying for, on a fixed cost basis, things like your administrative billing, your prescription drugs, your access to your PPO, network discounts, those type of things. But that other 70% is a projection, both on a max cost and expected cost basis of where the health plan, folks like us, will say, hey, this is where we believe that your claims are going to be. But those are capped. So you kind of know, again, what that worst case scenario is going to look like. And oftentimes it's actually better than what your fully insured annual premium is going to be. And so that's where health plans say, okay, this makes sense for us to fund it this way in a self-funded environment where, there may be some variations from month to month as far as what those claims look like. But at the end of the day, they still are capped. And if we don't have a claim, then that month, we're not paying anything out of our account. So we retain all of that. So that's why they are incentivized now to manage their employee population in a different way as well, because if they have a healthier population, that's more dollars saved at the end of the day.
Awesome. Can you talk about some of the technologies that you're integrating with Evolution Healthcare? There's obviously a lot required to deliver a plan, whether that's the operational analytics or the clinical analytics.
Yeah, from a claims management, care management, clinical dashboard, all of those components we have fully integrated into our health plan, and we have those in-house. And so by having those in-house and fully integrated, it allows us to get a full 360-degree picture of what is going on, with that population, both at a holistic level from employer standpoint, as well as at member level, because of things like a lower auto adjudication rate. A great example is when we had a member that had cystic fibrosis that had an episode, had an admission into the hospital, an inpatient stay. That was triggered in our system where in real time, a case manager was able to reach out and work with the provider group to get that individual approved for what was called an iron lung that was able to prevent an additional readmission. So when you're talking about some of this technology, it's really cool when not only are you looking at things that happened, in the past, but also the present as well as the future. We're talking about, predictive modeling. So for example, we can do predictive modeling and assign a certain risk score to specific members or specific individuals within that health plan to, for example, say, how likely is this member to adhere to taking certain medication for a chronic condition? So a member is prescribed, Advair, which is an asthma inhaler medication, and modeling can predict, based on scoring, how likely that person is to consistently take that medication. And then from there, you can take the appropriate measures, reaching out to the member, connecting them with a team nurse, a health coach, a disease management team member, to make sure that we are communicating and advising that member at that appropriate level to avoid a situation where this month it's a no fill of that prescription, the following month it's a no fill of that prescription again, and the next thing you know, we have a member that is in the emergency room but because of an asthma attack when all this could have been avoided. So doing things like that, integrating all the different components of the health plan, how the plan is being utilized, overutilized, underutilized, prescription drugs, getting that holistic view, and then reaching out to the member. A disease management coach is reaching out, a nurse is reaching out. We're sending them notifications back to the member portal saying that they have a message out there that we would like them to review. We're sending them text messages to also communicate with them. So all those type of things to give that member the tools and resources to make the best educated decisions. On that note, as far as technology is concerned, when you look at new emerging things and what things are coming for the future, consumer-centric solutions, what strategies are going to help create a healthier future. A lot of it comes down to cost and transparency and tools that help members make better decisions to manage whatever may be going on in their life. And so one of the technology pieces that we have is called Healthcare Blue Book. Healthcare Blue Book is basically a tool that provides transparency around both cost and quality measures. And so what you can do with this tool is a member can log on to the Healthcare Blue Book app and review both providers as well as procedures from both a cost and quality standpoint. And they do this very simply in kind of a stoplight, red, yellow, green type of fashion, where a higher cost, lower quality type of provider would be a red light. Your middle of the road would be more of your yellow light, and then your green providers would be your higher quality, lower cost providers. And then the really cool piece about that is from there, by choosing maybe a green provider, they are incentivized by cash rewards, where they get to kind of reap some of the savings. Where if they went to a green provider compared to going to a red provider, and that saved the health plan, $15,000. Well, there's cash rewards that can be delivered back to the member level to say thank you for making a choice to go to a green provider. So doing things like that, providing transparency and providing tools. Not all providers are created equal when it comes to both cost and transparency. A provider that may be very good at cardiology services or surgeries that ranks in the 99th percentile for those type of things might rank in the bottom 10th percentile for something like a bone marrow transplant. So providing those members with the tools to make educated decisions depending on what type of condition they have going on, what type of procedure they may need to have, and providing them with those tools to make better educated decisions can help both from a price and quality standpoint.
I'm familiar with Healthcare Blue Book. Tell me about remote monitoring, if that's incorporated in any way.
From a Fitbit or Apple Watch, those type of things, we can certainly integrate into our health plan and incorporate those into different disease management programs or different wellness activities, whether it be some type of step challenge, for example, those type of things we can certainly incorporate. But from a more chronic type of conditions or remote monitoring and how we're incorporating those type of things, we do partner with Livongo, which is a diabetes management program that we provide unlimited test strips as well as a glucose monitor to members that have type 1 and type 2 diabetes, which then allows them to control that in a better manner because they have access to those test strips as well as that glucose monitor. So it's a data-driven approach, personalizing it for those members, and giving them some support to drive ideally longer lasting outcomes. As far as health plans of the future, and what comes to mind is some of that remote monitoring, as well as a continued emphasis on virtual health. So virtual health services have been around for years, but no one really use them up until recently. Like it literally took a pandemic to get the utilization to go up to where now it's just kind of commonplace. But we work with Teladoc, and prior to COVID, the Teladoc physicians were doing about 20,000 consults per week. Now they're doing well over 100,000 per week. So you're starting to see it's becoming more commonplace where members, patients are realizing and recognizing that, wow, over 75% of the things that I would physically go into the doctor's office for, I can do via telehealth. And it's going to save me a bunch of time and potentially gas money and all those type of things. And what they're also realizing is over 90% of the virtual health visits are resolved within that first telehealth conference. And so you'll only continue to see that rise when it comes to virtual health. You'll really start to see that evolve in certain places as well. A new emerging one is behavioral health, the behavioral health component of telehealth. 1 in 5 employees are experiencing some type of behavioral health related issues right now. And so if you're an employer and you start to look at, how do I ensure that my employees are not only physically present at work, but they're also mentally present. And not only that, but they're productive, then having something like behavioral health is a fantastic resource. And the study that I read also said it surveyed thousands of employees and asked them, of new emerging type of health solutions, what is something that your employer currently doesn't offer that you would like to be offered in the future? And the number one thing was some type of behavioral health type of service or resource. So I think you'll see evolution with the behavioral health component and virtual health.
Zach, I want to ask one thing that's critically important to transitioning from classic fee-for-service models to something more value-based. The cardinal principles of good health, good nutrition, sleep, good hygiene, these things that we often take for granted in our healthcare system. Have you run into any barriers or challenges in creating a customized plan that can incorporate and capture some of those low-hanging fruit as far as wellness plans go or wellness initiatives go?
We have it. I think wellness is a really big buzzword, is what I've learned over the last 5, 6, 7 or so years. And you're just now starting to see data as far as what is the true return on my investment with a wellness type of program, and what are the specifics within a wellness program that actually make sense and deliver a better ROI, not only to the employer group, but to the specific patient and allow them to live a healthier and happier life. And doing things like a step challenge where you need to get 10,000 steps in a day, those type of things. While they're fun, I don't think that there's a whole lot of ROI there necessarily compared to doing things like health risk assessments and biometric screenings. So those are your more important things where you can really start to get a baseline on an individual as to, hey, it was really good that you came in today and got a biometric screening because your blood pressure is through the roof. And this is really alarming. We need to, create a strategy around this, or we're headed to somewhere not good. Doing more things like that and creating disease management programs to curb chronic conditions. That's where wellness programs, they make a lot of sense. Walking and exercising and those type of things are fantastic for step challenges and the Fitbits, but really doing more those health risk assessments, biometric screenings to get a baseline on an individual, and then creating a strategy from there.
I agree with you. I've heard this before, that most wellness programs have never shown a clear benefit, although certainly walking's good for you. Speaking of health risk assessment, we at TechLink want to automate those on the app so that patients can just fill them out even before they come into clinic. Have you seen that done by any of the providers?
I haven't, but what I'll tell you, kind of adding on to the wellness type of program, what we typically do is when you're coming from that fully insured environment, oftentimes, again, there's just very limited data and information to really understand or get a full picture of what is going on within that population's health. And so oftentimes they may not need a full-blown wellness program, at least to start. And so it may not make sense to build that in there, which is going to be an additional cost to an employer and maybe have a very low utilization with that employer's population. So what we typically do is offer a health risk assessment upfront but then we wait to build out a full-blown wellness program based on what is going on within that population and if it is or is not needed, as we continue to gather data on that employer group throughout the plan year and sit down on a quarterly basis and say, there are some things that are going on where you have a few diabetics or there's some things that we need to address from maybe getting a biometric screening completed, creating a disease management program. So we're doing those type of things, but I have not seen personally a health app that would have just kind of a health risk assessment out there on its platform for a member to use outside of the health plan. Is that kind of what you're talking about?
Yes. And the idea is to make it user-friendly for the provider as well as the patient, because a lot of this information can be collected before the visit. Right now, you have providers working on that in clinic, or the patients are filling it out together. There's a lot of variability there in how it's done. But I've worked as a medical director for a FQHC or a community health center in the past. And a lot of these were done in clinic where they could have been done before they even came in. I think it was just like partly digital divide and making it simple enough for patients to figure out how to do it. And then also the logistics around incorporating that information into a medical chart.
Yeah, I think it's a fantastic idea. One thing that I would encourage you to think about as well is, and this is something that I personally find as an obstacle to overcome when I'm working to get a group that's in a fully insured arrangement over into our self-funded one with Evolution Healthcare. In that fully insured environment, there is just limited data. On our side, there is an underwriting process and an actuarial type of process to identify what is going on within the group, what type of information do we know, what do their claims look like, are there large claimants out there where maybe an individual has cancer, and what's the prognosis of that. But unfortunately, in that fully insured space, that data is very limited and it is lagged. And so a lot of times what we end up requesting from an employer group is employee or individual health applications. As you know, that can be difficult to do. And I think there is an opportunity to do something where, in addition to some type of health assessment, you have data that is saved on that individual that can be shared in instances where we're working to provide a better solution from a health plan to our population moving forward. Oftentimes what I see is they'll have those individual applications completed, but they'll be outdated. They, depending on the state, they need to be updated every 60 days or every 90 days. And so having a place to house those where, okay, we've collected those and now let's make sure that they continue to be up to date through some type of notification process that says, hey, has anything changed recently with your health, or are you continuing to take this medication, or what's the prognosis on this as far as the technology, the interface? That could be a really good idea for someone to try and tap into.
Well, Zach, I want to respect your time. And so in closing, I'm curious if you have any final insights for those interested in staying connected to the next wave of innovations in healthcare.
Yeah, in closing, I would encourage people, especially if you're a business owner or if you're a CFO, to think about how exactly are you acquiring or buying your health insurance. For many, it's probably in 1 year increments where you're buying it in a very transactional manner. And if you start to peel back those layers and think about everything else that you as an employer may buy, leasing buildings, printers, copiers, vehicles, hiring employees, everything else is for the intent to last for multiple years, except for health insurance. That's the only thing that we're doing year after year after year in a very transactional, commoditized way. But we do not believe that healthcare is transactional or commoditized. We believe that healthcare is episodic. And a lot of the American population, when they're interacting with their health plan, it's because something is happening in their life that's requiring them to do so. It could be something as small as prevention to rule something out, or something as big as I've just been diagnosed with cancer. And now, what do I do? Who can help me? And so for us at Evolution Healthcare, and for those new emerging solutions in the self-funded arrangement, it's about putting the right pieces in place that are going to do exactly that. Help that individual manage whatever their health-related things are in a different capacity, in a different type of arrangement, so that we can slow down the cost of healthcare and make it much more manageable. And if we're going to do that, we have to think more strategic.
Thank you so much. And I would close by this quote. I recently heard that the healthcare system is about 4 trillion and about 1 trillion of it is waste. So what you're doing is certainly helping with that. And I hope you continue to grow.
Yeah, thank you guys so much. I really appreciate it. I've really enjoyed our conversation.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.